Good afternoon, it's Mark Larson, and I'm giving you the COVID-19 update. I will not give one tomorrow unless things drastically change, because tomorrow's a holiday here at Public Health. I will be here working, doing case and contact investigation through the weekend, but there may or may not be a video tomorrow. So today, the Kittitas County the Ellensburg Rodeo Board chose to cancel all of the activities around Labor Day weekend rodeo for safety concerns. They are making a safety decision for those people in Kittitas County and for those people that come to Kittitas County. That was a very difficult decision for the rodeo board to make, but I am supportive in their decision to do what's safe. So we will have rodeo again in 2021. So I'm going to go to questions, and then I'm going to end with our numbers for the day. So the first question is, talks about it's likely that everyone in Washington would get COVID-19. Would it be better to let everyone get the virus and deal with the backlash in the end? And if the coronavirus is a strand of SARS, wouldn't people who have contracted SARS have some sort of immunity? I can answer the last question, part of that question first. SARS is a different virus than COVID-19, as is MERS, which is also a different virus. And as far as we know, there's no cross-reactivity. We also do not know whether people that get COVID-19 actually develop long-lasting immunity. So there's a lot to know. And the reason we don't want to have everyone getting the disease is that even though young people tend to get milder disease, don't end up in the hospital, we have had 40-year-olds die in Yakima of COVID-19, and people can get really serious COVID-19 disease. So having everyone get the disease is a bad idea, and we don't know whether they would get it again. So, but a good question. What types of positive numbers or scenarios would have to be present for the local health department to recommend that all in-person school be canceled in September? That's a great question. It actually was asked by President Guadino today on a meeting that I had. What's our number for canceling? And the answer that I gave President Guadino is it depends. It's not just one number. It's whether our cases are going up, whether our percent positives are going up, whether we're overwhelming the hospital system, whether we're getting a lot of transfers of patients from Yakima with COVID-19 up to here because their hospitals are full. So I can't give you a specific number. I can just tell you that it's much more likely for us to use a surgical approach and try to say, okay, well, maybe it occurred in this particular kind of a classroom, let's say a science classroom where we have labs, or maybe it occurred in a lunchroom, and how could we change that? So a lot of work to go, but I can't give you a specific number, and our hope is not to cancel in-person school. I was in a business the other day and employees were not wearing masks. I heard the employees asking patrons if they wanted them to wear a mask, if they wanted to wear a mask. What's your advice? I had to be in the store for something that couldn't be accomplished elsewhere. So that's enforced by LNI. That's also enforced by local businesses if they choose to enforce that. Fred's Bike Shop, for example, the recycle shop, have been requiring people to wear masks to come in from the beginning. Each business has had the ability to do that. If you go to Yakima, that's not true. The governor has said those businesses cannot serve people if they don't have a mask. So as our numbers go up, that is one thing that I would expect to actually happen in regards to that. This talks about cases, hospitalizations, ventilators, and deaths. Summary as to where patients were contacted, how they got the disease, whether we have patients from other states or counties. So let's start with that. We've only had 2 patients transferred from Yakima to Kittitas County with COVID-19 because Yakima didn't have any space for them. We, over the years, have transferred patients to Yakima many times, so when we needed help, so we were doing that for them. We've had 2 patients that are Kittitas County residents be hospitalized here. One is currently hospitalized. They're doing well. I would expect them to be discharged in the next couple of days. We are a hotspot in Washington State. Our number is greater than 1 for the state, which tells us that the cases are going upward. We've not had any deaths in Kittitas County. As I said, we've had a low number of hospitalizations. We have had people on ventilators, but none of those 4 people that we've had in the hospital here have been on a ventilator. Why are we not getting more information about who's getting COVID in our county and why they're getting it? The question asks about Twin City Foods, whether now we're having community spread and demographics. So initially we had cases just kind of trickling in of people that were doing essential work. And then we had our outbreak at Twin City Foods. That outbreak was mostly younger people between 20 and 50, mostly Hispanic. That has gone away. And now what we're mostly seeing is outbreaks of much younger people. We have a group of people that went to a graduation party, a normal activity in a normal time, but not normal now. And have had multiple cases from that. We've had multiple cases secondary to another party in Upper County, another couple parties in Upper County. Again, normal activity in normal times, but not normal now. So our age of our folks are coming way down. Those people, if a 19-year-old gets COVID-19, it's quite possible that they're going to transmit it to their parents or their grandparents, especially on a holiday weekend. So we're very concerned about those numbers. The next question asks about skilled nursing facility. There is a document coming out probably early next week about reopening skilled nursing facilities. There's a question in here about numbers and whether or not our numbers reflect any positives at any of our skilled nursing facilities. We have not had a positive in our skilled nursing facility, which is probably why we haven't had a death yet either. So I think we're going to see some direction on opening up skilled nursing facilities, especially in low prevalence counties like ours. I would not expect in Yakima that are still in phase 1 to have their nursing facilities opened anytime soon. Next question was about daycare in elementary schools. So that's a problem. Daycares are allowed to be open. Masking requirements are different because their overarching structure of daycares is different. The people that regulate daycares are different than in schools. So than they are for OSPI. There's also unions involved in decisions to make. So yes, there's some inconsistency there of why my kid can go to daycare, but they can't go to kindergarten without a mask. I can just tell you that people are working on that. There's a lot of work on masking happening currently, and there's a lot of time between now and September. So I think the masking requirements will change. But I do know that if you want to push on a lever there, you should be pushing on a lever at OSPI on the Washington state level. And we'll see if we can get some closure on that. The other issue that people might ask is 6 feet versus 3 feet. So the American Academy of Pediatrics came out with some guidance in regards to they felt that 3 feet was as good as 6 feet. Again, I think that's really good guidance. It's not the guidance that's currently being followed by OSPI, so I think that'll probably change over time too, but I can't say when, but I know people are working on that. So the next question was about contact tracing at a specific facility. So when somebody has COVID-19, we from the health department call them and say you have COVID-19. We talk to them about all of their contacts that they have been around, that they've been closer than 6 feet for more than 15 minutes. That's considered a close contact. Other people are not considered a close contact. People have been really good at telling us who they've been around, but it's not always 100%. But we continue to talk to those people every day until they're cleared by public health. And occasionally somebody will say, oh yeah, I was next to this person, and we'll call that person the next day. Is there a concentration of COVID cases in Kittitas County, and where? Initially, we were gonna put some dots and some circles on places that had increased number of cases. It's difficult because this is a small county and we didn't really wanna identify an individual person. We're really concerned about people's privacy. But we will start putting some circles as our numbers have gone up. So the city of Ellensburg has the most cases. Upper County, Roslyn and Cle Elum and Ronald have a large number of cases currently. As we move forward, I would expect a lot more cases down in the lower valley in Ellensburg, especially as school gets open again and the college students come here. A few cases in Kittitas, a few cases in Thorpe, none in Vantage so far. This was a quote from Dr. Fauci. Bars, really not good, really not good. Congregation at a bar inside is bad news. We've really got to stop that. So bars are a problem. Bars are a place on the other side that we are able to congregate and socialize, but we are asking people to social distance and be farther away from each other. I think bars are problematic, just like gyms are problematic, and just like school is problematic. So those things are changing daily. I would expect to see some changes if our numbers keep going up. I would expect to see similar changes that you have seen in Arizona, Texas, and Florida, where they've made some restrictions on alcohol sales at bars. And then the last question was about nursing homes. We have not had a positive at a nursing home yet. So what my ask for this weekend, so we had another positive today. That person is related to an essential business. Again, we're getting positives because people are out and about. My ask would be to enjoy the 4th, be kind to your neighbors, wear a mask, stay at home and celebrate the 4th. You don't, just because we can go out and have large congregate settings such as people less than 50, doesn't mean that you have to do that. And as we are in situations where there's more people, we're going to have more disease spread. If you do choose to do something this weekend to celebrate 4th of July, do it outside. And again, make sure you're wearing a mask and maintaining social distancing so we can continue to move forward and get to the point where we can open schools and get sports back going again. Have a good weekend. Thanks a lot.